Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the previous year questions of anatomy from AIIMS 2020. So let's start with the first question. Given is a model of embryological development of the heart, which structures develops from the area marked as A. Let's see the image. Here in the image, the structure which is marked is conus cordis, which is the middle part of bulbus cordis. The infundibulum of the heart develops from this structure. So the answer is option C, that is infundibulum. Let's move towards the other question. A muscle is attached to the area marked in the given image. What is the action of this muscle on the hip joint? Let's see the image first. Here in the image, the area which is marked is the gluteal tuberosity, and the muscle that is inserted here is the gluteus maximus, which causes extension and lateral rotation of the hip joint. So the answer to this question is option D, that is extension and lateral rotation. Now the next question, neurotransmitters secreted by the area marked in the given image is. Let's see the image. Here in the image, the area which is marked is the substantia nigra. How do we identify it? The substantia nigra is the area which is the darkly stained, it means it is the dark substance. The neurotransmitter secreted by this area is the dopamine. So the answer to this question is option B, that is dopamine. Let's move towards the other question, that is, which of the following arteries pass in close proximity to the area marked by the arrow in the given image? Let's see the image. Here in the image, the area which is marked by the arrow is the pterion, and the artery that passes in close proximity to this area is the middle meningeal artery. So the answer to this question is option B, that is middle meningeal artery. Now let's move towards the other question. Where are the ito cells in the liver located? The ito cells or hepatic stellate cells are located in the space of Deci and they are mesenchymal in origin. Space of Deci. So the answer is A. Now let's know few facts about the space of Deci. It is the perisinusoidal space or and is a location in the liver between the hepatocytes and the liver sinusoids. Now, the significance of ito cells. Ito cells are in a dormant state for the majority of the duration. They store the fat-soluble vitamin A in their lipid droplets and are a significant source of growth factors involved in liver homeostasis and regeneration. Let's move towards the other question. Which of the following features differentiates the exocrine pancreas from the parotid gland? The absence of striated duct in the exocrine pancreas differentiates it from the parotid gland. So the answer is option B, that is absence of striated duct. All the other options are not the differentiating feature for exocrine pancreas from parotid. Now the next question. Medial lemniscus is a continuation of which of the following structures? Medial lemniscus is the continuation of fasciculus gracilis. So the answer is option D, that is fasciculus gracilis. Now the next question. The type of fibers present in the fornix are. The fibers which are present in the fornix are association fibers except for the hippocampal commissure of fornix which has commissural fibers. Hence, most appropriate answer is option A, that is both association and commissural fibers. So the answer is A. Now the next question. Decussation of the superior cerebellar peduncles occurs at which level? The decussation of the superior cerebellar peduncle occurs in the midbrain at the level of inferior colliculus. So the answer is option B, that is midbrain. Now the next question. The pretracheal layer of deep cervical fossa encloses all of the following except esophagus. It is enclosed within the pretracheal layer of deep cervical fossa. Sternocleidomastoid. No, because it is enclosed in the investing layer of deep cervical fossa. It is enclosed in the investing layer of deep cervical fossa. Let's see the other options. Sternohyoid and thyroid gland. All of the structures are enclosed within the pretracheal layer except the B, that is sternocleidomastoid. So the answer is option B. Now the next question. All of the following are the contents of carotid sheath except the sympathetic chain. It is not the content of carotid sheath. Let's see the other options. Carotid artery, yeah, it is the content of carotid sheath. Internal jugular vein, it is also the content. 10th cranial nerve, it is also the content of carotid sheath, except sympathetic chain, which is not the content of carotid sheath. Now the next question. A patient presented with a paradoxical respiration. Which of the following nerves is most likely to be affected? Let's see the image. First of all, paradoxical respiration. How does it occurs? It occurs due to the damage of the phrenic nerve. And phrenic nerve in the image is marked by the option D. Let's identify all the other nerves. A is the vagus nerve, right vagus nerve. B is the left vagus nerve. C is the recurrent laryngeal nerve. And D is the right phrenic nerve. So the answer is option D, that is D. Now the next question. Which of the following muscles is attached to the area marked in the image below? The area marked in the image is the palmar aspect of the first metacarpal, and the opponent's pollicis is the muscle which is inserted at the site. So the answer is option C, that is opponent's pollicis. Now the next question. Which of the following marked structures does not form part of laryngeal skeleton? The structure marked as A is the hyoid bone, and it doesn't form the part of laryngeal skeleton. Let's identify all the other structures. The structure which is marked A is the hyoid bone, B is the thyroid cartilage, C is the epiglottis, and D is the cricoid cartilage. Epiglottis, cricoid, and thyroid cartilage all are the parts of laryngeal skeleton except the hyoid bone. So the answer is option A, that is hyoid. Now the next question. Identify the foramen marked in the image below. Here in the image shows the sphenoid bone, and the foramen marked is the foramen rotundum. Maxillary branch of the trigeminal nerve passes through it. So the answer is option A, that is foramen rotundum. Now the next question. Reticular fibers are not present in which of the following structures? Reticular fibers are mainly found in all the lymphoid organs like spleen, lymph node, and bone marrow. And so the first option, that is thymus, it doesn't contain reticular fibers because it is present in lymph node, bone marrow, and spleen, but it is not present in thymus. So the answer is option A. Now the next question. Which of the following muscles is not involved in the overhead abduction of the arm? Let's see the options. Serratus anterior, deltoid, trapezius, and pectoralis major. Pectoralis major is the muscle which is mainly involved in adduction and medial rotation of the arm and is not involved in the abduction of the arm. So the answer is option D, that is pectoralis major. Now the next question, the structures marked in the image below are found in the epithelial lining of all of the following sites except. First of all, the image shows an arrow mark pointing towards the cilia. All the structures given in the options have a ciliated lining epithelium except epididymis, which is lined by the pseudostratified columnar epithelium with stereocilia. So the answer is option B, that is epididymis. Now the next question, which of the following bony structures is present behind the marked area? The structure marked in the image is the pterion, and the bony structure that is present behind it is the lesser wing of sphenoid. So the answer is option B, that is lesser wing of sphenoid. Now the next question, all of the following nerves are involved in the movement of eyeball except the nerve marked as A is the optic nerve and it is not involved in the movement of the eyeball. Rest all the nerves which is marked. B is the oculomotor nerve, C is the abducent nerve, and D is the trochlear nerve. These nerves are involved in the movement of eyeball except A, that is the optic nerve. So the answer is option A. Now the next question. The middle radioulnar joint is an example of fibrous joint that is syndesmosis. So the answer is option D, that is fibrous joint. Now the next question, what is the action of the muscle at the hip which is attached to the marked area in the given image below? The image shows the posterior surface of the femur and the structure marked is gluteal tuberosity to which the gluteal maximus muscle is attached and it causes the extension and lateral rotation of the hip joint. So the answer is option B, that is extension and lateral rotation of the hip joint. Now the next question, identify the level of the cross section shown in the image below. The cross section which is shown in the image is the level of T3, T4 because it shows the large vascular opening of the arch of aorta, along with the three small openings corresponding to the brachiocephalic trunk, left common carotid artery, and left subclavian artery. This suggests that the section was taken at the level of between T3 and T4. So the answer is option C, that is T3, T4. Now the next question, a patient is unable to abduct his arm. Which of the following root values is likely to be affected? The inability to abduct the arm is most likely due to the lesion of the C5 root. So the answer is option B, that is C5. Thank you so much. We have completed the previous year questions of AIIMS 2020.